Hello. Um, Video now. Post surgery. Surgery was yesterday. What a day it was! It was that was a long one. Got up at 4:30 in the morning, showered. Had to put on special soap. I'd done a cleanse the day before to wash everything out, much like with the colonoscopy, get everything squeaky clean. Um, Checked in at 5:30. They did the pre-op stuff, got me all hooked up, and I went into surgery around 7:30, and I was done around 2. So it was a long one. They wheeled me in there. I got to see the robotic machine they're using, which was really cool. It has all these arms and things. It's like a giant futuristic kind of spidery thing. It's really cool looking, actually. And that was, went in there. Everyone was really nice. Went out, came back. I was having an argument with Robert De Niro as his character in Killers of the Flower Moon. Don't know why. And I was in big days. That was a lot of anesthesia. I was under for 6.5 hours, so that was a long one. And so they gave me all kinds of anti-nausea medicine. Woke up, I had a catheter in, and everything went great. Everything went according to plan. So that was good news. I was in the post-op room for quite a while. Um, with my lovely wife Felicia, and different doctors and nurses doing things, and got a little bit of food in me then. I was feeling pretty sore, and but they gave me some good pain meds, but laying down was about all I was doing. Later we came into my room where I'm staying now, and moving from that hospital bed to this bed was quite tough. I didn't, man, my stomach, I feel like feels like as if, I've never been stabbed, but I imagine this is what it feel like if you've been stabbed like 5 times. So my upper abdomen is quite tender right now. It's interesting because the work they did was on the right side, and all the holes and things are on the left side, because they get in there, because they put in one, they pump up with it, fill you up with air, so they get a good so they can like really see around, and then they go on from the other side because it's easier for them to have more distance, I guess. And then I have one incision that's about 2 inches long where everything was removed from. They had to make it big enough to remove things. Um, they removed my entire ascending colon, and yeah, reattached everything. So got back to my bed here. Lots of pain, a little bit of nausea. A couple times, I think that was coming down from the anesthesia. I had a lot of anesthesia, and so I had a little bit of nausea, but got past that. Um, they had to check my blood every hour for a while, because my just to check my blood sugar levels. So every hour they come and poke my finger, run a little test on it, see where I'm at, and because you have to really it's really important for the surgery that I had to make sure that it's in a certain range. And there were different things, like they did a blood test this morning, and I was low on magnesium and potassium, so they added a little bit of that to my IV drip. Um, but just today feeling a lot better. Middle of the night, everything started working again, which is good. That was the first milestone, was for me to um, pass gas, to actually to have my bowels actually work. The whole thing, then they know that it's all working properly. And I did pass gas, but I was sleeping, and I passed a lot more with it too. Um, and I woke up right at the end of it, like, oh wow, and I see what happened, and I was like, oh crap. And then I knocked down my little thing that I can call the nurse on. So I couldn't get that. So I had to kind of unhook my feet from these. I have these compressors on that kind of squeeze every once in a while, just to kind of prevent clotting, since I'm not walking a lot for a little bit. And so I had to get up, remove all that without helping. It was really hard to sit up without the help of anybody. And finally rang the buzzer. A new guy came in. I never met him. He's like, "Hi, I'm Ryan." I'm like, "Ryan, I have some good news and I have some bad news." But he was cool. I went in the bathroom and cleaned up, and and he got everything freshened up here. So I got back in bed, and after that was it. And then after that, just started passing gas, and which was great because I was so bloated. I was so bloated. I had so much pressure in my intestines. I still do, but once they started moving, what a relief! Felt so much better. So I've been kind of napping on and off here and there since then. Managed to have a nice breakfast. Well, like very, very, very scrambled mashed up eggs and a plain English muffin, but it was good. I felt great as soon as I ate. That was good. Everyone keeps checking my vitals, and everything is going right along, per as it should be. I still have a lot of achy here, a lot of achy even with the pain meds, but as long as as long as I get in a comfortable position on the bed, yeah. So physical therapist came in to see me and called me up because they really want me to be ambulatory. Part of the healing process with this, it's important to be up, moving, walking, moving around. It really helps get things going. She taught me how to get out of bed easier, so it's not because, man, you don't realize how much you use your abdominal muscles, man, until they're injured like this. Wow, every movement, everything, even sitting here, you're talking. When just talking, it's just you use your abdomen so much that I can just feel it all. So and getting up is especially hard. So she taught me how to kind of roll over on my side and use different muscles to get up, and that helped. I got up for a while and was a little bit dizzy, but we went and did some laps around the halls. Did a few laps, moved around. That was good. It actually felt really good to be standing up. Just kind of stretching things and rather than laying here compressing it. So they're encouraging me to do that, a couple more times today, and just keep walking, moving around. They finally removed the the IVs and things. Those are all gone. They're it's just here. If I need anything, they can plug me back in. But it's all oral medicine or injectables. I have an injection daily for anti-clotting, basically anticoagulating. Just because you gotta be careful. And they also moved my my whatchamacallit, the the thing that goes in your pee hole. Why can't I think of that right now? Jeez, pain meds are doing something to me right now. Anyways, that was a relief to get out. Yeah. And yeah. So I'm just waiting for lunch right now. Doing good. It's quite a process. It was very involved. I'll be here for maybe 2 more days, maybe 1 more day, depends. But the doctors, they're encouraging me to stay for 2 more days after this, just to keep an eye on me, so they can monitor me. But so far, so good. The doctor said the procedure went well, and so hopefully they got all the cancer out, and that's it. And I'll report back soon with more information.